Hi, Liz here from Tutor 2 Health and Social Care. I'm joined by Lynn. Hi, Lynn.
Hi everyone.
So this evening we are doing BTEC National Health and Social Care Unit 3 Anatomy and Physiology, and this evening we are doing the quite tricky topics of homeostasis and genetics. So let me load up our PowerPoint. Okay, so to join in at home, please make sure you're a subscriber and then you can type your answers into the chat box. If you want a shout out, you can also type your name in there and we will give you a shout. Okay, hi Alicia. So let's have a look at our first activity. So the first thing we're going to do is a word smash. Hi Asosa as well. So with a word smash, you need to look at the picture on the screen and the word clue, and you need to smash them together. So we've got a picture which is showing a lion with a cross through, and then a person with a tick. And then the clue says the physical structure of a person or animal made up of organs, tissues, and systems that work together. So we need to work out what the picture is showing and what that clue is, and then smash them together to come up with a new keyword. So, Lynn, what are you thinking about that picture?
Well, I'm thinking the picture is not an animal,
Yep.
but it's ticking that it's a man. So I'm thinking that that might be a human.
Okay, yep.
Yeah.
And then what do you think
And
of that sort of definition, that clue?
on the right, I'm thinking something to do with maybe a body. So the physical structure of a person or an animal is made up of organs, is their body.
Okay, let's
Something
have
to
a
do with
look.
their physical body, human body. There
You
you
are
go.
right. I can see that my life has said dominant allele. My life, you're like already forging ahead into genetics. We're starting you off simple,
Yeah,
but
yeah, yeah,
excellent work. Okay, so
yeah,
human body. So
yeah.
we're on homeostasis for now, not genetics yet. So let's have a look at the next one. This might be a bit more straightforward. Okay, so on the left of my screen, I'm looking at some thermometers. One
Yeah.
showing like 30 degrees centigrade, and the other one is showing like -5. And then the clue says the process of controlling or maintaining something within a specific range or set of rules. Remember, homeostasis. What do you think this is representing on the screen? Have a think. Okay,
Yeah, well done.
Princess says regulation, yeah.
So that might be the word on the right then, regulation, the
Yep,
process of controlling or maintaining something. And my life on the left has said temperature. So if we were to smash those words together, we might get
brilliant. Yep,
what
Alicia's
Alicia says.
saying,
Yeah.
yep, brilliant. And actually, well done, my life. I'm going to give you a round of applause because thermoregulation is the more technical way of saying temperature regulation.
Yeah.
So brilliant, well done.
Well
Okay,
done.
let's have a look at another one of those. Maybe I'll just show it to you and see if you can guess without me talking you through it. What do we think about this one?
Pop your answer in the chat if you see it.
Remember, we're thinking about homeostasis. Lynn, what are you thinking?
I'm thinking, well, the first thing I think is water.
Yeah, me
But then
too.
I'm thinking maybe, yes, sort of more of a general term around that, then maybe more like fluid or that kind of thing.
Okay.
Um,
Alicia said equilibrium. That's a very nice word, but I think that's a little bit too fancy for what we're looking for. It's it's a good word for that clue, but ours is a bit more basic than that.
Yeah. What's the sort of I was going to say basic word, but then I nearly gave it away. I'm
Princess
thinking balance. I'm thinking balance.
Princess has said osmoregulation. Brilliant, Princess. That is not my word, but that is the technical term for my keyword. So well done, Princess. Give you a round of applause. It's more simple than that, and it's straight off your Unit 3 specification, which is fluid balance.
Brilliant.
Yet my life has just said it, just as I've revealed it. Well done. Okay,
Brilliant.
so linked to that, what do you see on the screen now?
And this might be two words coming out of that first picture. Am I right, Liz?
Yeah.
Yeah.
So this has 3 words.
Yeah.
And we've already actually had that clue, the process of controlling or maintaining something within a specific range or set of rules. We've already had that word. I think there is quite a delay, Lynn, tonight between you and I broadcasting and people at home seeing. So
yeah, that's all right.
it's that
So
busy
as soon
time
as you
of
think you've
night.
got it, yeah, pop it in.
Okay, my life saying negative feedback. No, good guess, but that's not what I'm looking for.
What do you think the
Princess is
pictures
saying
are?
homeostasis. Yeah, literally, just say what you see in those 2 pictures.
Yeah. So what do you think those pictures represent?
Shall I reveal?
Yeah, let's just reveal.
It is blood glucose regulation. So that's a drop of blood, some glucose tablets, and then the definition of regulation. So thermoregulation or temperature regulation, fluid balance, blood glucose regulation, regulation of heart rate. Those are the things that you need to know about to answer questions on homeostasis in your exam. So let's move on. I think we have some MCQs now, Lynn.
Yeah, so well, the first question we're going to start with is what is homeostasis? So we've got A, B, C, and D options. If you could put A, B, C, or D into the chat. So is homeostasis the maintenance of a stable internal environment in the body? Is it the process of cell division? Is it the production of energy in the cells? Or is it the breakdown of nutrients in the digestive system? Hopefully, this is quite an easier one to get started. I can see that Princess, My Life, and Asosa have all said A, the maintenance of a stable internal environment in the body.
Brilliant. I think Alicia has said A as well. Well done, guys. Okay, number 2.
And somebody's already mentioned this term already this evening, so they're straight off the block. So what is negative feedback? My Life, you mentioned it. So is it a process that amplifies changes in the body's internal environment? Is it a mechanism where the body detects changes and counteracts them to maintain balance? Or is it a system that prevents the body from responding to external stimuli? Or is it a feedback loop that only occurs during illness or injury? What do we think? What does negative feedback, what's the purpose of that? So really good responses tonight, Liz. So
really
Princess, My Life, Fosa, and Elisha all said B.
Yeah, brilliant.
Have a little look.
Absolutely right.
Yeah. So we've got that emphasis on the counteracts. Yeah, negative feedback is there to counteract, to maintain balance. Yeah, well done.
Number 3.
Which of the following is an example of negative feedback then? So could that be swelling caused by an allergic reaction, blood clotting during injury, increased heart rate during exercise, or the body shivering to raise body temperature when it's cold? Which of those feels like an example of negative feedback?
And if we think about our Unit 3 specification, remember we talked at the beginning, what did we say? Temperature regulation, blood glucose regulation, fluid balance, and heart rate regulation.
So a few mixed responses here, Liz. We've got some B's, D's, A's, D's. So yeah, a few different responses. So we have the answer is actually D, the body shivering to raise temperature when it's cold. So very much about that temperature regulation.
Well done to My Life and Princess getting that one right. Okay, number 4.
Which part of the body plays a key role in regulating body temperature? So which part of the body? Is it the hypothalamus? Is it the pancreas? Is it the kidneys? Or is it the liver? What do you reckon? Which part of the body regulates body temperature?
I can see Princess Magic and My Life straight in saying A, hypothalamus. Alicia is saying hypothalamus as well.
Great.
And Asosa, well done, everyone.
Been doing some good revision here on homeostasis today. Excellent.
Round of applause, sorry. Okay, number 5.
What hormone does the pancreas release to lower blood glucose levels? So is it insulin, glycogen, adrenaline, or cortisol? Which one of those do you think the pancreas releases? So a few people coming in. A has come up with A.
Yeah.
Thanks for joining us, A. Princess Magic's also gone for insulin.
And Alicia has as well, and Asosa. Brilliant.
Well done. That's sounding
done.
good to me. Yeah, well done.
Question 6, Lynn.
And which of the following is a function of the kidneys in maintaining fluid balance? So, is the kidney function increasing body temperature during fever? Or is it producing insulin to regulate blood sugar? Or filtering waste and excess water from the blood? Or storing glycogen for energy? So which of the following is a function of the kidneys when they need to maintain fluid balance? What would we say? So I think Princess, My Life, Sosa, all coming in at
Alicia as well.
Filtering waste and excess water from the blood.
Well done, guys.
That's very good. Well done. That is what you think of the kidneys. Well done, everyone. Okay, so what is the purpose of vasodilation in temperature regulation? Okay, is it to generate heat by contracting muscles, to reduce heat loss by narrowing blood vessels, to increase heat loss by widening blood vessels near the skin surface, or is it to conserve water by reducing sweat production? What do we think?
So A has already come straight in and said C, and so has Princess Magic and Alicia and Asosa. Well done,
Brilliant.
guys.
Yeah,
because
excellent.
all of those answers are about temperature regulation, but only C is vasodilation. So well done.
Yeah. Well done. Excellent
question
job.
8.
We're hitting them with the multiple choices, aren't we? So what condition can result from the failure of homeostatic mechanisms to regulate temperature? Okay, so could you get diabetes, be dehydrated, hypothermia, or anemia? Which one? So if those homeostatic mechanisms fail to regulate body temperature, what could happen to you? What do we reckon?
Okay, I can see My Life, Princess, and Alicia all saying C.
Yeah.
Person A has said B, and I can see where you're going with that one.
Yeah. Both focusing on the body temperature. So therefore, we're going to be thinking about hypothermia. Well done.
Obviously,
excellent.
if you got warm, you could also become dehydrated. So well done.
Yeah.
Okay, so now we're going to do some true or falses, and we're moving on to genetics now.
Mm-hmm.
Okay, so I'll read out the statement, and then I want you to type in the chat either true or false, or T or F, or thumbs up or thumbs down. So our first statement: Mendelian inheritance explains how traits are passed from parents to offspring through discrete units called genes. Is that true or is that false?
So just write T or F in the chat based on what you think.
I can see lots of T's coming through, Lim. They're all, there
brilliant.
You go. All zooming up on your screen. Well done, guys. Okay, the second one. Mendel's law of segregation states individuals possess 2 alleles and a parent passes only 1 allele to his or her offspring. Is this true or is this false? So read it through again. Is it true or false?
Just pop T or F in the chat. See what you think.
Okay, Princess says false, Alicia says true. So if we think about this, what it's saying is I have 2 alleles, and if I have a child with my husband, I pass 1 allele and he passes 1 allele. Is that true or false? That might make it easier for you guys to understand. So Asosa is saying true. Yeah, it is true.
Who's coming in? Well done.
Well done. Yeah, Princess, it's like, oh, okay, yeah, true. So the next one, there are 3 major patterns of Mendelian inheritance for disease traits. These are autosomal dominant, autosomal recessive, and X-linked. Is this true or false? So we talk about conditions being genetically inherited through different patterns of inheritance. Autosomal dominant, autosomal recessive, and X-linked. Is that true or false? There are other patterns maybe, but are these the major ones?
Yeah.
Okay, we're getting some falses. Princess is saying true. This one is true. So
Yeah.
some genetically inherited diseases are X-linked, so that means that they're linked to the X chromosome. Okay, so autosomal dominant, recessive, and X-linked are your main types, and the genetically inherited disorders that you learn about in health and social care are one of those 3 inheritance patterns. Okay, I think over to you now, Lynn, for some
Well done.
clues.
So we're going to do our big reveal. Okay, so we want you to work out what's hidden behind the question mark before we reveal all of the clues. So we're going to take it in turns to reveal. And as you think you might get it, pop it into the chat. Am I right in saying that these are all conditions? Liz, does that help people?
Yep.
Yeah, a little bit. Yeah. So to get you off the starting block, think about conditions. So let's start with our first clue. It is named after the British doctor who first described it in 1866. So a little bit of a history lesson there. Any ideas?
Not sure it's that helpful, is it?
Not really, not unless you sort of know how things were first, came about. Okay, should we look at our second clue then? We've got screening during pregnancy can involve neutral translucency measurements.
Okay, so nuchal translucency is all about the thickness of the fold on the back of the neck. So you can have an ultrasound scan at around 20 weeks of pregnancy to measure the fold on the back of the neck.
Okay. Does that help you think about a particular condition?
Should we go for another clue?
Yeah, let's have a little look. Individuals often experience developmental delay and distinctive facial features. Okay. It's getting a bit more information now. Anybody say, so somebody had a go with penicillin, Princess, so talking about obviously a medicine there.
Yeah.
That's not right. Keep guessing. But, good guess from the first clue, actually.
Yeah, exactly. My life says trisomy 21. I think we have a clue that might talk about that. Shall I reveal the next clue so we can see?
Yeah, let's have a look. So it's the most common chromosomal condition diagnosed in the UK. SOSA is saying Down syndrome. So let's have a look. Yeah, so this condition is linked to trisomy affecting chromosome 21. So My Life and SOSA, you are a great team there. And we have Down syndrome. I think we need a round of applause for them. Well done, everyone. Excellent. Well done.
So trisomy 21 refers to having 3 copies of chromosome 21. Okay, let's move on to the next one then.
Okay, so we're still on the idea of conditions. This condition is caused by a mutation in the PAH gene. Okay.
I don't think that really helps us. That's quite a
So we've got
complex clue
happening.
Yeah.
What does that mean? Let's have another clue. This condition is commonly detected through the heel prick test in newborns. Okay, that's a bit more of a clue.
So on day 5 of the baby's life, the midwife takes a sample of blood, which is tested for a variety of conditions, including this one. Some people might want to have a go at guessing from here. So My Life's saying cystic fibrosis, Princess Magic is saying PKU, both of which can be detected in the heel prick test. Alicia's saying Huntington's.
Disease, okay.
I think we need to have some more clues, don't we, to pin this down?
Let's have a look. So left untreated, it can cause severe intellectual disabilities and developmental issues. Okay.
Shall we have another clue?
Yeah. you could relate that to a number of conditions, I suppose. It affects the body's ability to break down an amino acid found in protein-rich foods. Okay.
Okay, my life has changed her answer to PKU.
Yeah, quite a
Associate
few.
is saying PKU or cystic fibrosis. I think from clue 4, we can rule out cystic fibrosis, probably from clue 3 as well, actually. Alicia's saying PKU. My life's saying PKU for sure.
For sure, love
For
it.
sure.
Okay,
Let's have a look at number 5.
Yeah, this treatment involves a strict low-protein diet and supplements.
Yep,
So,
shall we reveal?
is it PKU for sure?
Yes.
It is, yes. Well done. Brilliant. Great job with you.
Well done, my life. Brilliant work.
Extra marks if you can pronounce it. So, yeah.
Phenylketonuria. Do I get the mark?
Yeah, you do. I've been practicing it. Phenylketonuria. Yes, I've been practicing
But
as well, Liz.
I have the advantage of having been a midwife, so I should be able to
You
pronounce
have to
that
learn
word.
it.
Yeah.
Yeah.
Okay, let's do our next one. So another condition now.
Okay, so this condition is caused by a mutation in the HBB gene. Okay, so another gene mutation.
You might get it from this one if you know about HB. But let's move on to the next one.
It's the most common in individuals of African, Caribbean, or Mediterranean descent.
I think that's a very strong clue for this one. Let's see if anyone at home can get it from this one. They're a little bit delayed.
Yeah, give people a second.
Okay,
one.
my life has said sickle cell. Straight
Okay.
in. Anyone else? Should we go for the next clue?
Yeah, everyone's doing very well on their conditions. The red blood cells take on unusual crescent shapes.
Okay,
They look a
Asosa
bit
is
more
saying
banana.
sickle cell. Alicia saying sickle cell anemia. Let's go for the next one.
Symptoms can include pain crisis, anemia, and risk of infection. Definitely think we're on the right track, aren't we? It's a blood disorder where the misshapen cells can block blood. I'm sorry, misshapen cells can block blood flow.
Yeah, sickle cell disease. Well done.
Sickle cell.
Well done, my life, for being straight in there, and Asosa as well. Okay, I think we've got one more of these. Or no, two more.
Okay, keep going on your conditions. So this condition is caused by mutations in the CFTR gene. Okay. It's one of the most common life-limiting inherited disorders in the UK. I think people are going to get this because they are doing very well with knowing their conditions.
So. My life is straight in saying cystic fibrosis.
Fibrosis. Okay.
I think they actually got that from CFTR gene, so well done, my life.
Yeah, that's brilliant. Let's have a little look.
Princess Magic is saying Huntington's.
One more clue. The sweat test is a key diagnostic tool for this condition. Okay.
Alicia is saying cystic fibrosis. Let's give you number 4.
It primarily affects the lungs and digestive system, causing mucus buildup.
I think
That's sort of like a key aspect of this condition, isn't it? And common treatments include a physiotherapy and enzyme supplements. So let's have a look if you're right with cystic fibrosis. Well done. Yeah, excellent. Give you a round of applause for that. Well done. And then do we have one more, I think, Liz?
We do, yeah.
Yeah. So
we should be able to get this one now. Process of elimination.
Yeah. You've literally gone through all of the conditions. So this condition is also caused by a genetic mutation involving the CAG repeat expansions. Okay, it's an autosomal dominant disorder, meaning that only one parent needs to pass on the gene. And it shares its name with the physician who first described it in 1872. So another little bit of history for you there.
It's actually quite hard making these clues difficult.
Yeah.
Okay, Alicia's saying Huntington's.
It's
Princess
an interesting
Magic
fact.
saying Huntington's as well.
Okay, let's see. For symptoms typically begin in middle age and progressively worsen as people get older. And number 5, symptoms include involuntary movements and cognitive decline. Are we right, Liz, with Huntington's disease? Yep. Yes, we are. Excellent. Well done, everyone.
Good job.
We're very, very strong on the conditions tonight.
Brilliant. Okay, so I think this is our last activity of the evening, and it is Mend the Gap. So I'm going to show you a paragraph about diagnostic testing for genetic and chromosomal disorders, and some of the words have been blanked out, and we need to work out what goes in the blanks. Okay, so our first sentence says, diagnostic testing such as blank and blank helps identify genetic and chromosomal conditions during pregnancy. So have a
Okay.
think about that. Diagnostic testing in pregnancy, there are two types. Do we know what those two types are?
Yeah. So thinking about what the diagnostic tests are.
Okay, my life is so rapid on this, saying chronic villus sampling and amniocentesis. Alicia's saying the one where there is a needle put into the uterus. Princess
Okay.
Magic says amniocentesis and then got too excited and hit return. Liquid from pregnancy. Okay, so let's have a look. Diagnostic testing such
Yeah.
as amniocentesis and
Brilliant.
chorionic villus sampling. So actually both of those involve inserting a needle. Amniocentesis involves extracting blank to test for disorders like Down syndrome, while CVS uses a sample of blank for similar testing. So in both cases, they use a needle which they insert really carefully whilst doing an ultrasound scan. Amniocentesis, they extract something, and CVS, they use a sample of something. Do we know which one is which?
Yeah. What might they be testing? Let's
Okay,
have a
my
little
life
look.
is saying amniotic. Amniotic what, my life? There's actually two
Yeah.
words we need there, and cell. Yeah, they are looking at cells, but from what? There's a
Yeah.
structure that they're actually looking at. Okay, amniotic fluid, yep. And then where do they get those cells from for the
Yeah.
chorionic villus sampling?
What would you often give a sample of?
Okay, my life is saying the placenta or womb, yep. Okay, let's have a look. So amniocentesis involves extracting amniotic fluid to test for disorders like Down syndrome, while CVS uses a sample of placental tissue. So they take a really small part of the placenta and test it.
Well
Yep, well
done.
done, Alicia. Very clear there, saying amniotic fluid and cells from the placenta. Yep. Both
Excellent.
procedures carry a small risk of blank, but provide essential information for decision making. So, what is the risk of these two procedures? Okay, my life is straight in there saying miscarriage. Yep, brilliant. So, essentially, these diagnostic testings are not done unless another screening test comes back as high risk, and then it's up to the family to decide whether they want to have amniocentesis or a CVS because they carry a risk of miscarriage. Princess Magic has said infection. That's actually true as well. There is always a risk of infection when you do any invasive procedure. So inserting a needle does introduce the possibility of an infection. And Alicia, yeah, you're right. Miscarriage, it means the loss of the baby.
Well
Okay,
done.
so that is the last one that we have this evening for our homeostasis and genetics. Well done, everyone. Give you a round of applause and an air horn. If you guys are doing Unit 2, come back in 15 minutes at 6:30. I'm going to do Unit 2. Otherwise, join us next Tuesday lunchtime. We're doing Unit 1, Unit 3 and Unit 2 again. And also check back on the website tomorrow for the PowerPoint. Thank you so much for joining us. Have a good evening if you're not coming back, and see you again soon.
Bye, everyone. Thank you.